My name is Christine Roman, and I would like to provide just a little bit of background uh, related to my journey in learning about CVI. The segments that you're going to see provided by the West Virginia Department of Education are really based on a set of principles that I have gathered over a great number of years. I started out as a teacher of the visually impaired, working with children birth to 21 in a public school setting. In that setting, I worked with children who had visual impairment, who were braille readers, some who had low vision and used low vision devices, children who had who were on consult or direct service. And in addition to those students, I also had the opportunity to go to a residential setting where there were children who had multiple challenges. In that setting, there were children that were on my caseload who had cataracts or glaucoma. And then there was this other population of children who were in classrooms and would just kind of stare at lights or show kind of non-purposeful gaze, this attention toward nothing, which we now know probably really has a purpose. At the time, the classroom teachers would, challenge me and ask me, well, Chris, you work with this child with glaucoma. Why is it you're not working with this other child who acts like they don't see? So I would, pour through their medical records and look through their large files that were in this setting, searching for information that would help them qualify for my services. At the time, qualification was really based on acuity or visual field, also the identification of certain kinds of eye conditions. But in almost every case, none of that information was present. So I was kind of faced with a quandary. Do I work with these children who I certainly agreed had very different visual responses, or do I adhere to that standard that said there's a rule for what visual impairment really is, and it's defined in a very specific way? Well, I actually did work with those children, and my caseload really doubled almost overnight because of that. I didn't have a name for the condition that those children likely had, but I learned later that those were probably all children with CVI. I want to also share that in my additional training that I went through, I also became certified in orientation and mobility. I got a master's degree in medically fragile high-risk infants, worked as an infant developmental specialist in a neonatal intensive care unit. Also went on to get my doctorate in education, focusing on CVI. And as time progressed, as I got more skills, as I learned more, I began to really recognize the very specific needs of those children with CVI. And I think it's critical that I share that in those early days when I was working in that setting, when the teachers said to me, please work with these children, and I did, that I'm now quite sure I was ineffective. That the techniques I used with those children, that the approaches that I thought were correct, were all based on a construct for children with eye disorders, because that's all I knew. I've learned much later that there is a separate construct for children with cortical visual impairment, that they follow a protocol, a set of rules that really are incredibly separate from the rules kind of for ocular visual impairment. It was one of my first big aha moments. So I also want to mention that the work that I have developed was really initially developed for me to be the most effective vision educator I could be. That even as I was working in university settings and other places, hospital settings, I always had direct contact with children. And I realized that I needed to kind of develop a framework for working with children with CVI that really met their specific needs based on those 10 characteristics. The early work of Drs. Jan, Groenveld, and so forth really helped support my thinking around what that construct should look like. I had no idea at the time that in becoming very organized in my assessment and interventions for children with CVI, that there would be a giant surprise waiting for me at the other end of that process. And that surprise was the outcome of improved functional vision. I really didn't anticipate that. I had no construct because, again, my training was on ocular visual impairment, which usually doesn't result in improved visual function. But these children were different. And I began to notice that as I plotted these children on this thing that I eventually called the CVI range, a number line, a 0 to 10 scale, that as I looked at that, I noticed that over time those children's scores were improving, and that those improvements in scores were paired directly with improvements in that child's functioning across almost all developmental domains. So I've learned many things, and I also want to share that the things that I have learned are a work in progress, that I realize for sure that what I knew in the early years of my teaching certainly isn't adequate today. What I learned in the middle stages of my career isn't adequate today. And even what I know today will not be adequate for serving children with CVI in the future. That this is an unfolding process, one that is ever changing, and that we can expect to continue to investigate and learn more carefully. As more research occurs about the brain, as we understand how vision really works in the brain at greater and greater levels, we'll begin to understand how plasticity really operates relative to vision and why these improvements are really happening. But for now, we do the best we can with what we've learned and know that what we know today will not be adequate for what we need to know in the future. A few things that I want to sort of mention that really kind of are overarching constructs around all the segments that you will see on the West Virginia website included several principles. One of them is, of course, to expect improvement, that the functional vision of children with CVI is expected to improve, and that almost all children show these improvements. That in research that my husband, Dr. Alan Lancy, and I published in 2010 shows that of the children we've seen in our project in Pittsburgh called Pediatric View, in that project, we saw that more than 95% of the children that we see there achieve a score into phase 3 CVI, which is a score between 7 and 10. We think that there's a reason that occurs. We see families at Pediatric View who are different. They don't have to come there to have their child evaluated. They come with a great deal of motivation, and they come seeking information. So I challenge all of us to think that if we continue to pursue the greatest amount of information, and if we have the highest level of passion and motivation for the students that we serve who have CVI, I imagine we too will see these incredible outcomes. I also have learned that parents are the primary educators when it comes to the construct around CVI. They're fabulous, trained educators who have embraced the principles of CVI and who have provided impressive leadership. But I never want to stray too far from what I can learn from parents who continue to show us that their investment in their child results in pretty amazing results. So stay close to the families, respect the families, and use them as your greatest resource. Also, that we have an opportunity to impact a child's life in ways that will increase their quality of life, potentially, across all developmental domains. That there is no area of human development that is not impacted by visual impairment. So we have this amazing opportunity to really provide a very powerful tool in the life of a child with CVI, regardless of their other abilities. You know, children with CVI are a diverse group. Some have significant and profound challenges. Others have fewer challenges. But what they share in common are these characteristics, and that's what we can, kind of identify, evaluate, and manipulate in ways that provide the child access. So I hope that you'll enjoy watching these videos. I'm sure that you have your own thoughts and ideas about some of the information provided, and I really appreciate your time and attention to this very important topic. Thank you.